brief introductory knowledge and a discussion about surrogacy, doctor-patient, relationship, abortion, anesthesia, female infanticide, professional ethics, corporate governance, and ethical responsibility. We'll have discussed here. Not in much detail, but in very brief, what it is generally. So surrogacy is what? It involves a woman carrying who is surrogate and giving birth to a child for another individual or couple, intended parent. So there is surrogate and there is intended parent. Medical ethics in surrogacy focus on rights, well-being, and consent of all the parties involved. So, it, what should be an ethical approach? That surrogacy respect the autonomy and informed consent of the surrogate mother and intended parents. It ensures that surrogates are not exploited or coerced or subjected to take risks beyond acceptable limits, and consider the best interest and well-being of the child born through surrogacy. So, surrogacy is a practice in which a woman agrees to carry and give birth to a child for another couple. There are many ethical issues surrounding surrogacy, including the rights of the surrogate mother, the rights of the child, and the commercialization of surrogacy. So, ethics then play a very important role here. Now, talking about doctor-patient relationship, so doctor-patient relationship is very fiduciary relationship, which means that doctor has a duty to act as in the best interest of the patient. There are many ethical issues that can arise in the doctor-patient relationship, such as informed consent, confidentiality, and end-to-end life care. So, as doctor is a cornerstone of medical ethics, emphasizing trust, confidentiality, and well-being of the patient. So, physicians must provide patient with accurate information about their condition, treatment options, and potential risks. And physicians are ethically obligated to maintain patient confidentiality unless there is nothing compelling reason to breach it. And principle to do no harm guides physicians in making decisions that prioritize the patient's welfare. For example, doctor-patient confidentiality. Doctor cannot disclose a patient's medical history for others without the patient's explicit consent during privacy and trust. And in India, there was a commercial surrogacy ban in 2019 to prevent exploitation of vulnerable women. However, altruistic surrogacy is still allowed under certain conditions. So, now coming back to abortion. So, abortion is what? What do you understand? It is a termination of pregnancy by the removal or expulsion of an embryo or fetus from the uterus. There are many ethical issues surrounding abortion, including the moral status of the fetus, the rights of the pregnant women, and the role of government in regulating abortion. So, there is a ethical autonomy, the ethical perspective on abortion as respect to women's right to make decisions about her body, about their reproductive choices. So, it is a very complex consideration of women's reproductive rights, status of the fetus, and the social implication on the abortion. Balancing a woman's autonomy with potential real rights of fetus. So, fetus has some rights. Is a central ethical concern, and there is a consideration of health risks, social economic factors, and the impact of the women's well-being influence ethical judgments. So, in India, Act of 1971, that is India's Medical Termination of Pregnancy Act, allow abortion in certain circumstances, such as a threat to the woman's life or physical or mental health. So under this act, it is a legal abortion. But nowadays, many problem is coming, and new issues are emerging. Now, anesthesia, female infanticide, female. So first, talking about anesthesia. Anesthesia is a practice of intentionally ending the life of a person who is terminally ill or in a persistent vegetative state. There are many ethical issues in surrounding anesthesia, including the definition of a state, the role of the doctor, whether he should kill it, he should have a right that the life is a nature's gift, so something like that, and the slippery slope argument. So it is intentional ending a person's life to relieve suffering. Medical ethics in anesthesia evolves around the principle of autonomy, compassion, and the potential of abuse. For abuse, it can be abused. So it is also Ethical anesthesia respect individuals' rights to make end-to-life decisions based on their values and sufferings. And about quality of life, ethical debate involves considering whether the potential benefit of anesthesia overweights its potential harm. So then there are anesthesia laws and regulations vary globally, affecting the ethical consideration. So in Aruna Sangabanga case in India, there is a positive anesthesia that led to Supreme Court allowing passive anesthesia under specific conditions involving irreversible coma or brain damage. So if there is a condition of irreversible coma and brain damage, then passive anesthesia can be done. Now talking about medical infanticide, very sad incident that deliberate killing of female infants often due to cultural preferences for male children. Medical ethics intersect the societal values and gender equality. So, ethics consideration involves around harmful impact of female infanticide on gender inequality and dignity of women. And there is a root cause of female infanticide involves challenging deeply ingrained on cultural norms and biases. There are biases towards boys and girls. So, medical professionals play a great role in advocating against female infanticide and promoting the value of child's life. For example, Beti Bachao campaign, Beti Bachao Beti Padhao, Save the Daughter, Educate the Daughter aims to raise awareness about the importance of girls and women and counter gender-based discrimination. Then, talking about professional ethics. So, professional ethics, before professional ethics, female killing is a serious problem in many parts of the world, in India also. Many factors contribute to female infanticide, including gender discrimination, poverty, and preference to the male child. Then, talking to professional ethics, then we have corporate governance. So under professional ethics, corporate governance is a point where governance is a system by which corporation is directed and controlled. There are many ethical issues surrounding corporate governance, such as role of board of directors, the disclosure of financial information, and prevention of corruption. Then there is there should be transparency, governance, and decision making and business operation accountability and ethical leadership. Then here comes ethical responsibility, which is obligation to act in an ethical manner. It is important for professionals to be aware of their ethical responsibilities and act in accordance with them. There are many different ethical frameworks that can be used to guide professional conduct, such as Golden Rule, Hippocratic Oath, and Code of Ethics for nurses. So there are few examples of ethics that can arise in context of medicine professional life. It is important for professionals to aware of these issues.